actually a Philadelphia native, and when I was at the University of Scranton, the extracurricular activities I participated in were primarily centered at the school, besides a few volunteer experiences at Moses Taylor. So in contrast to that, at TCMC, I feel like firstly, I took a number of years off before transitioning into medical school from undergrad. So for me, I've seen a definite transformation in what Scranton was when I left college to how it is now. I've seen a number of new businesses open up, and also the fact that a number of my classmates are not from the area has given me a chance to kind of re-explore Scranton. So one of my new discoveries since I've come back is all the way up Prescott Ave, and there's this little cafe called Mansour's, which I fell in love with, and across the street is a yoga studio called Prana, which I think is fabulous as well. And there's a number of other businesses in the area that I enjoy.
And for me, as someone who's lived in Scranton my entire life, maybe I haven't gotten to know the area better, but I feel like we've definitely learned a lot more about the changing healthcare landscape since graduating from the University of Scranton. And also a lot of the opportunities that I had at the University of Scranton, such as studying abroad, have helped me, not only in my life, with my life experiences, but also in a healthcare setting.
I've also lived in Scranton my entire life, but I think what I've noticed most is that how there's a large influx of younger students in the area now, and I've seen how that's changing the area a lot. Like a lot of my friends this year live in gorgeous new housing downtown. There's a lot of new buildings popping up that are kind of geared towards our age. More things to do.
I'm Philadelphia originally, went to the University of Scranton. Is how my University of Scranton experience and the Jesuit ideals have really continued into medical education. One of the nice things about our model at TCMC is that we've been forced to go out into the community, and I think as someone who comes from a Jesuit educational background, it's nice to be able to really practice holistic care. So it's nice for me when we go out into the community, and I really feel like I'm practicing being a man and my colleagues being a woman for others. It's really nice to go out and to see all of the nice things that Scranton really has that I never experienced as an undergrad, to see all of the people that you never meet. One story that I always tell is that I ran into a trash worker, someone, sanitation engineer, and he said to me, "Oh, you go to our medical school." So I think it's really cool now to see the pride. Some people are like, "Oh, you're a U student," but now being at TCMC, we're a part of the community. We go to our medical school, where it's the community's medical school, and I think that is really unique, and it's something that I didn't experience at Scranton that I really love about being in Scranton now.
After graduating the University of Scranton, I'm from the area, so I feel like I had decent knowledge of the area, but I got to explore a lot more than I had previously. So specifically in the area of food, I got to explore different cuisines I never really tried, like especially Mexican food that I never really experienced at the cafe. Got to find other restaurants here, and then like other things such as the gym, just finding a place to work out and things like that. Just to explore different things. Like I know we have a gym here, but people now find out like there's CrossFit in the area, and I know a lot of people like doing that. So it was just a nice way to explore the neighboring locations that are around.
Okay, so my impression of Scranton has definitely changed since I graduated. I graduated in 2012 and then became a student at TCMC. So I think the word physician shortage, or that phrase, gets thrown around a lot. And yeah, you want to try to fix that and whatever, but what really made me realize the shortage here was actually my experience through ISP at Scranton when we went to Ecuador and actually see poverty and live through it. That kind of opened my eyes to what physician shortage really is and the need for physicians, especially in rural areas. So being at TCMC was a perfect transition because we do a lot of work in rural and underserved areas, and I think as a result of my experiences at TCMC, I've developed more appreciation for just how important it is to try to work on that problem in northeastern Pennsylvania.
For me, it was at Scranton. I was only mostly on campus. The only thing I did was some volunteering at Moses Taylor, and being at TCMC sort of opens your eyes to what else Scranton needs and what you can do for Scranton or your patients with regards to caring for the whole person, because that's one of the ideals of the University of Scranton, cure personalis, and one of the things that we focus on at TCMC is the patient-centered approach, which is really caring for the whole person, not just looking at disease. or a problem that a patient has, but actually going beyond and making sure that, you know, their psychosocial status, psychosocially speaking, they're fine, in addition to treating them for their disease. So that has helped a lot with me talking to patients and their approach.